Okay, I am in the med room and I am going to look over the patient chart. So I have Sam Johnson of a date of birth of 18XX, no known allergies, and a high fall risk and a full code. Sam Johnson is here for dehydration and a fall that occurred at home. She has a past medical history of hypertension and asthma and medications of furosemide, albuterol inhaler, and acetaminophen. She is 145 pounds, 5 feet 4 inches, so about average. She is within normal vital signs of heart rate of 76, blood pressure of 128/72, respirations of 20, and SpO2 of 98. And then she is alert and oriented. She has clear breath sounds, normal bowel sounds, and voided clear urine. She's pink and warm, and once again, alert and oriented. She has an IV in the right arm, and she is going to have labs drawn. She's once again a high fall risk and has sores from fall, and she's going to be needing 2 medications now. So now I'm going to go into my patient's med room. Okay, knock, knock. Hi, can I get your name and date of birth?
Sam Johnson, 18XX.
Okay, I'm just checking I have Sam Johnson, 18XX. Okay, hi, I'm Grace. I'm going to be your student nurse today. I'm just wanting to tell you about the 2 injections I'm going to be giving you today. So I'm going to be giving you 2 medications. The first one is going to be intramuscular, and it's going to go into your deltoid muscle, which is your Fluzone. Fluzone is medication. It's a vaccine that's going to be given because it is given yearly, and it's to prevent the flu from occurring. And so it can have some side effects, such as redness, soreness, or itching at the site of the injection that I give, and it can also cause a fever about 2 days after the injection. So I just want you to be aware that those can occur, not that they will, but just so you know. And so then it also, fluoxetine can be given in your vastus lateralis thigh muscle, or in your ventral gluteus, which is in your gluteus, but I'm going to be doing it in your deltoid muscle. Do you have any questions about the fluoxetine?
Yeah, I'm just wondering, does the flu vaccine cause the flu?
No, so this one is for respiratory, and so it will not cause you to get sick. It will just prevent you from getting sick, and so the only thing is that it can cause a fever, but that will not always occur. That is just a possibility. Mm-hmm. And so then the other medication or injection that I'm going to be giving you today is heparin, which is going to be so you don't form blood clots in your body, because you aren't really immobile right now, so we want to prevent those blood clots from forming. So I'm going to be doing that in your abdomen, but the heparin can actually be given in the front of your thigh, below or around your scapula, and it can also be given in lateral of your arm, but today we're going to be giving in your abdomen. So just some side effects of the heparin is that it can cause nausea and vomiting, or any, again, soreness or redness around the injection site, and so I just want you to be aware of those. It can also cause you some fatigue, so if you're tired or anything, or if you're experiencing any of those, I just want you to hit that call light or let me know. We can do something about that, okay?
Sounds good.
Okay, and then I also just want to make sure, before I go and get those medications ready, that you have no allergies.
Oh, yes, I don't have any allergies.
Okay, and is there anything or any questions that you have for me?
Nope, I think I'm all good.
Okay, now I'm going to go back into my med room. I'm going to perform hand hygiene. Okay, now I'm going into my med room. Okay, so I'm going to do my first med check of Fluzone. So I have Fluzone here. Fluzone is for Sam Johnson. Sam Johnson, I have a date of birth of 18XX. Sam Johnson is needing Fluzone of 0.5 milliliters intramuscular injection for the flu vaccine. And so here I have Fluzone, which is 0.5 milliliters, which is an intramuscular injection. So once again, I have Sam Johnson for the Fluzone. We have Sam Johnson for Fluzone of 0.5 milliliters and 0.5 milliliters vaccine. And it is going to be intramuscular injection, and this is an intramuscular injection. It is due now, so I will be giving this now when I administer it. So that is my first med check. I also want to make sure that the expiration date is good, it is clear, there's no fogginess or any discoloration. Okay, now I'm going to do, my first med check of heparin. So here I have heparin for Sam Johnson, date of birth 18XX. So Sam Johnson is needing heparin of 5,000 units per 1 milliliter subcutaneously. So here I have heparin, 5,000 units per 1 milliliter. So here we have heparin for Sam Johnson, of 5,000 units per 1 milliliter, 5,000 units per 1 milliliter, and this is going to be given subcutaneously. And this is a subcutaneously route. And it is due now, so I'm going to be giving this now once I get it drawn up. Okay, now I am going to draw up my medications. So first I am going to do my Fluzone. I'm going to prepare my stuff. So I have here my 25 gauge needle with my 1 inch length. That is for my Fluzone. Then I have an injector. And then I also need a dull. I need my dull. Which are in here. Okay, so now that I have my dull needles, which are needed for both, now I can start my medication. Okay, so here, okay, now I am going to want to clean for 15 seconds my Fluzone. That was for 15 seconds for the video. So now I would, without getting it unsterile, I would take this and take my doll. There we go. So now I am going to draw up 0.5 milliliters of air. Okay, I have 0.5 milliliters of air. I'm going to put this in my Fluzone. I'm going to eject it. Now I'm going to get 0.5 milliliters. Okay. Okay, now I'm going to recap this by doing the scoop method. Recapped. Okay, now that is off. Now I'm going to put it on my 25 gauge needle. Okay, now I have my 25 gauge needle, and I would get out my air bubbles. Okay, just make sure that's away. Okay, now while I am here, I am going to do my med label. So here, this is for Fluzone. So Sam Johnson. Fluzone of 0.5 milliliters. And it's going to be given IM route, which is intramuscular route. Now I'm going to label. And now I'm going to show that I have 0.5 milliliters of my Fluzone. Okay, and it is labeled. Okay, so now I have that one done. Now I am going to do my next medication. So I'm going to take my doll and open it. And then I'm going to take my 25 gauge with 5/8 inch. You can also do a 23 gauge. 25 works. Okay. Good. Okay, now I would take my cap off. I'm going to clean for 15 seconds. Take the video, 15 seconds, and it would dry. And I'm going to take my syringe without getting it unsterile and connect. Now I am going to draw up 1 milliliter of air. Okay, I'm going to inject First, I'm going to push it in. Then I'm going to draw up the 1 milliliter. Okay. Take that out. Just want to get any of those bubbles out. Okay. I'm going to scoop method. Take that off. I'm going to put my 25 gauge on. Okay, now that this is on, just want to make sure all those air bubbles are out. Okay, so now I can show the 1 milliliter. Okay, good. Now I'm going to label this, which is my Sam Johnson heparin of 1 milliliter per the 5,000. This is going to be given sub-Q. Okay, right to attach. Okay, now I have my 2 medications. Now I can do my second med check. So here I have, I'm going to do my Fluzone first. So I have for Sam Johnson, date of birth 18XX, for Fluzone, which is due now, and I have Sam Johnson for Fluzone, due now, for 0.5 milliliters intramuscular injection, and I have 0.5 milliliters intramuscular injection. That looks good, and once again, this is for Sam Johnson, Fluzone, 0.5 milliliters intramuscular injection, due now, for the flu vaccine. Okay, and now I have Sam Johnson, date of birth 18XX, and she is needing heparin of 5,000 units per 1 milliliter. Here I have Sam Johnson heparin, 1 milliliter per 5,000 units, which is subcutaneously administered. This heparin is going to be given subcutaneously, and it is due now. So once again, I have for Sam Johnson the heparin, Sam Johnson heparin of 5,000 units per 1 milliliter, 5,000 units per 1 milliliter, subcutaneously, and this is subcutaneously, and it is due now, and this is to prevent blood clots from forming. Okay, now I am going to dispose of my gloves. Okay, going to take my supplies and go into my patient's room. Knock, knock. Okay. Hi, this is Grace again from earlier. I am the student nurse. Can I get your name and date of birth, please?
Sure. Sam Johnson, 18XX.
Okay, perfect. Now I'm just checking bracelet. I have Sam Johnson, 18XX. And I'm just going to scan. Good. We have Sam Johnson, 18XX. Okay, Sam, so I just want to make sure that you remember that I am going to be giving you your 2 injections, one of Fluzone and one of heparin.
Okay, sounds good.
Okay, I'm just going to make sure that the bed is raised. Okay, good. Okay, Sam, can I just clarify that you have no allergies?
Yeah, no allergies.
Okay, and I want to make sure that once again you remember the Fluzone is a vaccine so that you won't get the flu in the future during the flu season, and the heparin is to prevent you from forming blood clots.
That sounds good.
Okay, so now I'm going to perform hand hygiene. I am going to put on gloves. Okay. So I'm going to be giving you your Fluzone first after I do my 3rd med check. And that's gonna go in your deltoid muscle. Okay, so now I'm going to do my Fluzone med check. Here I have my Fluzone for Sam Johnson. Sam Johnson Fluzone needed now. 0.5 milliliters intramuscular, and I have 0.5 milliliters of Fluzone intramuscular. And it is for Sam Johnson, due now, intramuscular Fluzone, 0.5 milliliters for a flu vaccine. And here I have that. So I am going to scan my medication. It's scanned. Okay. Now I am going to give the medication. Okay, Sam, so now I'm going to give you your flu zone. I want you to let me know if you're feeling nauseous or anything, or you need me to stop, okay?
Sure, sounds good.
Okay, I'm going to start in the center and go in a circular motion outwards. Okay. Taking that off, I am going to make sure that I prime. Okay, and it is primed. Bevel is up. Now I'm going to do the Z-track method where I pull back and I'm going to go at a 90-degree angle. And I'm going to administer slowly. Okay, good. Now I would put on the safety. Okay, and now I would get rid of that. Okay. Now, Sam, are you feeling okay?
Yeah, I feel good.
Okay, now if there was any bleeding or anything, I would put a Band-Aid and apply pressure, but for the sake of video, it's good. Okay, then I would document that I gave the flu zone, document. Okay, now I am going to do my third med check of my heparin. So I have heparin here. So I have it for Sam Johnson, heparin, and here I have Sam Johnson for heparin. The heparin is 1 milliliter subcutaneously, and this is 1 milliliter subcutaneously. Here I have the heparin. So once again, I have Sam Johnson, and I have Sam Johnson for heparin, and I have heparin here. The heparin is 5,000 units per 1 milliliter, and I have 5,000 units per 1 milliliter. It's going to be given subcutaneously. Subcutaneously, it is due now, so I'm going to give it now, and it is used to prevent for blood clots. So once again, just want to make sure that this is for Sam. And so then I am going to scan heparin. Heparin is now in. Okay, now I am going to just show what is needed. Okay, Sam, feeling okay there?
Yeah, I feel good.
Okay, now I'm going to clean. Gonna go out from inward, outward in a circular motion. Okay. Going to take off the cap. I am going to prime. Okay. Now I am going to squeeze and I am going to go at a 45-degree angle. Slowly administer the medication. And go. Apply any pressure that's needed. Cap here. Okay, then I would bring this here. I would take off my gloves. Sam, are you feeling okay?
Yeah, I actually feel pretty good.
Okay, just want to make sure that that is good. Okay, then I would dispose of my gloves. I would document. Okay, then I would leave. Okay, Sam, is there anything I can get you before?
I think I'm good.
Okay, I would lower the bed because of the fall risk. I would give call light. Sure, okay. Now I'm going to leave. Okay, and then I would come back 15 to 30 minutes later. Hi Sam, how are you doing today?
I'm feeling good.
Okay, I'm just checking that I have Sam Johnson here, 18XX. Okay, Sam, I'm Grace. I was here earlier. I gave you 2 injections of Fluzone and heparin. Just want to make sure that you're feeling good. You didn't have any of those side effects that we talked about.
No, I feel pretty good.
Okay, and I would just make sure that I would recheck her vital signs and her labs, like her platelet and her blood count. Make sure that everything's good there. Make sure all of her vital signs are good, just as they were when I came here. And that is all.
That was good.